to send out just a quick story now.
Hmm.
Sapri,
Yeah, you can do. Yeah, we can. You
ask him
can take.
to register, share the registration link, tell them join us
Yeah,
now.
yeah.
Get there,
Starting now.
get
Yeah,
there. Yeah. Oh, you know what I forgot to put on the, we're not live yet, are we?
we are live.
Oh, hi guys. Uh, So I'll call on Sapri afterwards. So let's go, shall we?
Yeah, yeah. Let's start.
Right. So, hello, everyone. Welcome, welcome, welcome to this webinar. We've been building towards this moment for quite a while, and we have some exciting news today. We have our panel here, spanning the UK, Germany, and most importantly, India. And today we are here with some amazing news for doctors in India. So if you're a doctor in India watching this, this is specifically for you. Um, and today we're going to be talking about the launch of the Global Medics program for the NHS. And it is your step-by-step pathway to a career in the NHS. We're going to tell you a little bit more about who the principals are because we have put together a really incredible team to bring this program to you. But before we get into what this Global Medics program for the NHS is about, I am Alicia Banfield. I was previously in my old life, I started life as a medical and public health doctor before I then transitioned into teaching medical English. I became a premium OET preparation provider after getting TEFL and TESOL certified. And very quickly afterwards, I founded and became director of Banfields Professional Medical English, or Banfields. Um, and we specialize in courses for medical English, the occupational health, and now IELTS. So that's a little bit about me. Now I want to turn to our Indian doctors who are out there watching this and who will join us in the webinar. And I want to ask you this question. What would you do if you had more professional opportunities? Now just take a second and think about that. What would you do? For some of you, it could be that there's a specialty you want to go into and you would specialize. It could be that there may not be that many opportunities for the specialty that you have, that you want to go into, or it could be that you're aware that somewhere else they've got a program that you really want to get into. It could be that your focus is increasing your income. Yes, being a doctor is a very well-paid job, but of course, like all other areas, some areas earn more than others. Maybe there's an area of research you want to go into, or there is another colleague that you want to collaborate with. And working abroad would give you a chance to get into a fellowship or get into a research program. Or maybe your primary focus is your family, doing more for your family now, as well as opening up their opportunities in the future. And that is what primarily the Global Medics program is about. It is a step-by-step pathway to reaching that very goal. And for some people, the question might be, is that attainable? And the answer is yes. Yes, a job abroad is attainable. A job in the NHS is attainable. First step, however, you need to understand the steps you have to go through. You've got to ask the right questions at the right time, get answers. And the team we have put together here, they are prime place to give you the answers to any questions you can throw at them. And then, of course, you have to plan your future and give us 1 year. Maybe a little bit less, maybe a little bit more, but give us 1 year. So, what is this Global Medics program and who is bringing it to you? What is the credibility? What are the credentials of this amazing team that we've put together? Well, first of all, as you can see here, it is a collaboration between Hive Medical Academy, who spearheaded this project. They are in the UK, on the ground in Manchester. Banfield's Professional Medical English, and you heard a little bit about me and what we do at the very beginning, and InSync on the ground in Chennai and India. And with us today is Dr. Shaquille, who is the lead, the director and CEO of Hive Medical Academy, and Dr. Umar, who is the PLAB guru, the PLAB UK MLA guru. I am here to talk about the importance of the language side, and master language trainer Shane is here today, and he is going to give all of the insights not only into his incredible background, but also into the knowledge he brings to the table and how he deals with candidates in India and the opportunities he is placed to provide for you there. Okay, so just so you know, just to sum up what this team is bringing to the table, 35 years of practice inside the NHS. So we're talking insider knowledge. 35 years of accredited language teaching. And we'll talk more about that later. 20 years of candidate service and support, because we are nothing without our teams working behind to make sure everything flows smoothly. 10 plus years of knowledge of the immigration process, especially between India and the UK. And between us, we speak 9 languages, most of them Hindi, but also a couple of Western languages as well. And on that note, I'll just add so that this team is what I call uniquely qualified to pull together this program that we have accomplished. We bring entry to international healthcare systems, specifically the NHS. We're bringing it right to you in India, okay? They are vastly qualified in creating the UK MLA PLAB program. They are not only experienced doctors, they've done it themselves, then professionally taught all the clinical and non-clinical aspects. They understand cultural transition and challenges that immigrants face, how to face them, and how to provide counseling from day one. They're multilingual, academically qualified language trainers, helping to ensure that the OET IELTS is successful and seamless. They know every step and pain point of the complex immigration process and how to stay one step ahead and on track to help make everything as stress-free as possible. And additionally, decades of experience in client communication and support. So on that note, I am going to now pass over to Dr. Shaquille, who will now introduce Hive Medical Academy and everything it brings to the table.
Thank you so much, Alicia. That was the beautiful words, and it's a great opportunity for all the Indian doctors. It will open several doors of the beautiful career in the UK. So, right. So let's start the webinar. So this was our webinar for today. This is for mainly for the doctors from the India and how we could help them for the beautiful career in the UK. We have got some learning opportunities and learning objectives of this webinar. First, the doctors who wants to have a dream career in the NHS and the journey of an international medical graduate from anywhere in the world to the NHS. So our learning objective will be, we are going to overview about the NHS, what's the structure of NHS and why the Indian doctors are in so much demand in NHS in UK. What are the key steps to become an NHS doctor? What's the process? What it involves? What could be the potential hurdles? What could be the potential obstacles in their journey? What are other challenges and how they could overcome about these challenges? So brief about me, I am one of international medical graduate who went through all this journey. I did the PLAB English exam, then the PLAB, and then completed all training in the UK from junior doctor to consultant, being in NHS for more than 20 years. And after that, I had a passion to support and facilitate our international medical graduate. And this is what passion which led to have a Hive Medical Academy, professional platform where we could support and facilitate all the doctors who are coming to UK. Right, briefly introduction to NHS. So NHS are world's best and largest organization. It was established in 1948 and it is free healthcare to all the residents in the UK, and it is funded by the taxation of the all the residents. Obviously, it has been established in several years, more than 75 years. So there are challenges because of the better facilities, better staffing, better everything. People are living longer, and the aging population is the biggest challenge. And second challenge is the shortage of the staff in the NHS. Why the shortage of staff? Because every year there are 5 to 7,000 doctors that are retiring as well. And there are vacancies always. The local doctors, they also move to different countries, they take breaks. So there's the big gap. And according to latest GMC workforce report, there are 52% are international doctors, nurses, they are filling these gaps. So international medical graduates, they are backbone of NHS. If they stop today, NHS will collapse within seconds. So how NHS works, what's the structure in NHS and the healthcare system in the UK? So we have got three types of setups. We have the primary care, where the frontliners, the GPs, dentists, and pharmacists, they're based in the community, GP surgeries. So any patient who have got the first thing, they contact to the GP, they have got the set practice in different areas, they have got different number of patients from hundreds to thousands. So they go to the GP. If the GP could not sort out their problem, they are sent to the secondary care, they are the hospitals. So in community, need to do your doorstep. You have got the GPs, dentists, and pharmacists for minor illnesses. You can go to GPs and dentists. Then you become the secondary. Then we have got the secondary care. The hospitals, more specialist emergency services, accident emergency, which runs 24/7, where they are more advanced and team is 24 hours there, and you get more investigations, more consultants available, more specialists available. Then we have got more advanced facilities in the NHS, which are like transplant and neurosurgeries, other things which are the tertiary care. So these are the basic three steps, the three sort of the structures in the NHS in the UK: primary care, secondary care, and the tertiary care. Why? Important. Why NHS needs Indian doctors and why they are so popular and why they are in demand. Hi. Uh, There is always, as I said, there's always a shortage of the doctors, and because of the increasing healthcare demand, and NHS heavily depend on international medical graduates, including Indian doctors. There are almost 40,000 plus doctors. There are Indian doctors in the NHS. Why they prefer Indian doctors? They have got solid background of the training. Their training, their English language, and they because they study their medicine in English. The skills, the training, the passion is outstanding. That's why always there are, if you imagine every year, 20 to 25,000 doctors from India, they're coming to the UK and setting up their career here. NHS believe that Indian doctors, they are far more hardworking than anybody else. They will take extra work, they will be available 24/7, they will do long hours, they will not say no to anything. So this is why There are majority of doctors, we see 40,000 plus in NHS, and they are backbone of NHS. And these doctors, from junior doctors to the higher levels, executive positions, they are there. So there are house officers, there are chief executives, there are top neurosurgeons, you will see top breast surgeons, top plastic surgeons, top orthopedic surgeons. You will see majority of the international medical graduates who are at that level. But if you see the current statistics, this is reference from the workforce, GMC workforce report, which is the latest one. 31,000 doctors in NHS, and all top roles they are filled by the. There are so many general practices, and they own the general practices in primary care. There are internal medicine physicians. So Indian doctors are everywhere, like from primary care, from specialist care, secondary care, tertiary care. They are filling all the gaps, and they are running the NHS. In other words, if you ask me, international medical graduates and Indian doctors, they are running the NHS. If they stop it, NHS will collapse, simply. Briefly coming to the PLAB journey, how we could start, how any international medical graduate could start his or her PLAB journey to become fill a space in the NHS and become like any other successful doctors in the NHS. The first thing they need is they need to be have a medical graduate from any recognized medical university. They must pass their English test, which is IELTS or OET, and then they pass PLAB 1. They need to pass their PLAB 2. Then clinical attachment, which is very important because that will give them the induction to the NHS, and they will know how the system works because there's the transition from their healthcare system to the different country and different healthcare system. Then they get the GMC registration and license to work and secure a job. So these are the simple 7 steps they need to secure a beautiful career in the NHS. Medical graduate, English test, PLAB 1, PLAB 2, clinical attachment, registration, and secure a job. Very simple steps, as I mentioned, UK journey from anywhere in the world, especially from India. If you're in final year, you start preparing for that. You do your English exam, PLAB 1, PLAB 2, and secure your job here in NHS. Right. UK, they have got very organized training system. Here in they have two sort of the training, and this training system was introduced in 2007 when the MMC was introduced, a modernizing medical career. So they divided training systems into two. One is foundation training and one is specialty training. For the foundation training, everybody who is a fresh graduate, either is a local graduate or from anywhere else in the world or India, they are eligible to apply for the foundation training. Foundation training is of the 2 years. FI1, foundation year 1, and FI2, foundation year 2. In foundation year, they will have the 4 months of rotation, 3 rotation each in different specialties. They would have option to choose what sort of the specialty they want to do it. And during this training will be paid. After they completed their foundation year 1, they will move to foundation year 2. And foundation year 2, again, they will have the 3 different rotations, 4 months of each rotation in different specialties. During these trainings, they will have their educational supervisor, they will have their clinical supervisor, and they will have their admin time, they will have their CBD time, they will have all the courses. These supervisors, they will closely monitor them, help them, guide them, and support them to complete their foundation training. All this training will be paid, and this training will give them a taste what they like and what they don't like. Like some specialties, if they're doing for like psychiatry or gynecology, medicine, so they will have exposure to all the specialties. So they will be in far better position after foundation year to make a decision what they want to do. Or they want to go into medicine because they liked medicine rotation, or they want to go into orthopedic because they like orthopedic rotation when they were doing. So foundation year, the pay will start from the 36,000. That's the 9 to 5 job pay. But on the top of it, if they want to do some locums or anything, they could do it. All the study leave courses will be paid. Once they have completed foundation program, they would have option again that they could do. Either they want to stay non-training post, or they want to go into medicine, or they want to go into the primary care as a general practitioner. So general practitioner training is of 3 years. 2 years rotation they do in the hospital, and 1 year they do in GP surgery. So during these 3 years of training, they have to complete MRCGP. part one and part two. Part one is AKT exam and part two is CPSA, the CSA exam. They have to complete this one. Once they have done this one, they will get the CCT and they will become a registered general practitioner. They could work as an independent general practitioner in the community. Shortest training, fully paid training, and just only for the 3 years for the GP. If you want to become a consultant in hospital, so that's different training after foundation year. The nationwide vacancy will be open. They could apply for the training. That's 3 to 7 years of training, ST1 to ST7. And during this training, they will have two educational supervisors, one educational supervisor, one clinical supervisor. They will support them, guide them, and they will have the different rotations in different specialties. All this training will be fully paid, and their pay will be increasing at each step of their exam. If they're going into medicine, they have to complete their MRCP exams. During ST2 and 3, they have to complete MRCP Part 1, which will be fully paid. All the study leaves, courses will be fully paid by the NHS. After that, they have to complete MRCP Part 2, and then finally, they have to do PACES, final part of the MRCP. Once they have done it, then final is CCT exam, which is Certificate of Completion of Training. Once they have done it, they will be registered consultant and specialist registered, so they can work it. The pay will be increasing. The training, they will have plenty of support. They have different supervisors, and they will have during this one. They always have the CBD time. They will have their admin time, and they will have study leave, annual leave. Everything will be fully paid. If they don't want to go to into training, I, somebody says no, I don't want to go to training. So they still they have got the option. They could apply for the non-training post. Non-training post, there are SHO post, locum post. They could have junior clinical fellow post, they could have senior clinical fellow post, they could have the trust grade post, and they could have a staff grade post. These are the non-training posts, but the work is almost same. Then after they have done couple of years or 5 years of staff grade or associate specialist post, they could work as a locum consultant. So there are loads of options for everyone. If somebody wants to go into training, they like want to become a GP, they will go on the GP route. 3 years of training, they become the GP. If they want to stay into medicine in hospital, secondary and tertiary care, they will choose the path of the specialty training. Every specialty, if they want to go to psychiatry, they will choose the psychiatry and that specialty exam, they have to do it. If they're going to stay in medicine, they could do it. And if they don't want to go into any training, they will apply for the non-training post, plenty of non-training posts, and they will become associate specialist or locum consultant. They could work that way. So always options, opportunities for everyone. It's not no limit that no, you have to go for the training or you have to go this one. No, it's entirely optional and choice of the candidate what they want to do it. Plenty of benefits working in NHS, working paid leave up to 41 days, you get it. And then if you're going to buy the house, you will be happily supported for the mortgage loan for the car. And you have got a pension, which is the best pension in the world for the NHS because it's the largest employer. And you get lots of other discounts from groceries to buying a house. And you have the apprenticeship schemes for the NHS doctors. So plenty of benefits, all your study leave, your annual leave, everything will be fully paid. Whatever you spend that you can claim back, your exam fees, you can claim back. Either you're spending your PLAB exam or English exam, once you'll be working, you can claim back. When you submit your tax returns, you can claim back that this what you spent on your exams to become a doctor. Right. Quickly, I will go through what could be the possible potential obstacles, challenges, or worries for an international medical graduate when they plan for a PLAB journey or when they're thinking for the PLAB journey. Most importantly, financial burden, financial pressure that they will be thinking, oh, it will be very expensive. How I'm going to manage is, would I get the job or not? I'm working as well, so how I'm going to manage it. Then secondly, they also think about because they're moving to the different country. So as the how it will work, would I get the visa? What's the immigration process there? What are the requirements? Do I fulfill all the requirements? And some people, obviously, they are not fresh graduates. If they're working, they have a job, they have a career, they have family, they think how they're going to balance with their work life and their exam life. Uh, some can they say that we have been working in 5 years and now going back to exams, would it be hard? So how is it going to work? Most important is cultural adaptation. There's a misconception that it will be very hard to come to the UK and adapt to the UK culture and those things. So most of the people they just drop the idea of moving to the UK just because of this one. So I will share in further slides, explain that this is just a misconception. But these are sort of the worries of the international medical graduates. They do think about these things because there are doctors. They don't think about that how we'll do the exam, how we'll pass exam. Lots of other things which are very important. They matter for them, and they worry about these things. Then once they have started those things, then think that when should I apply? What will be the right time for me to apply for the PLAB exam, and how I'm going to prepare for my exam? Who's going to help me? Especially in today's digital world, we have got everything in our hands. There's so much resources, so many things available on internet and everything. But they need to think, are they really trustworthy? Are they reliable? Are they going to help them to pass their exam? If they're not going to have these resources available online, they're not going to help them to pass their exam, then it's useless, waste of time. So again, they think about, should I join the academy? Should I go on the online courses? How I'm going to get the visa? Or who is going to help me to who book my ticket? Because we have come across some doctors who never traveled from one city to other city. So moving from their country to different country is a big thing. One state to another state, they haven't moved it. So if they will ask them, okay, you're planning to move to another different country where the people speak different language, they have got different culture. So it's a big deal for them. And then again, obviously, they're moving to different countries, so they'll ask where I'm going to live, who's going to pick me up from the airport, how I'm going to travel if I have joined the academy, how I'm going to travel from my accommodation to travel to the academy, and how I will travel. Would I get the job in the NHS? Am I a good doctor? How I'm going to work in the UK? So all these are sort of the worries, minus. So at time, if they don't have full support, guidance, and awareness and comprehensive resources, they will worry about these things more than their exams. Again, it's not, people think that it's not very easy exam. Well, if I'm taking exam, I'm spending my time and money, exam fee paying. So exam fee is quite big. So is it going to success, pressure of the success? Either I'm going to pass the exam. What will happen if I fail my exam? Do I need to pay again? And online, we don't have any structure, professional support or guidance or documents for the preparation. Again, that's the cultural transition. I'm going to move from my country. I worked in my hospital, my NHS, my care in different healthcare systems. So how I'm going to adjust there? Who is going to help me for this transition from my country to different country, from my healthcare system to the UK healthcare system? Again, as there are myths about the PLAB is the easier exam. No, it is not as easier. Passing PLAB guarantee the job. This is again another myth. It is not at all. Passing a PLAB exam is just passing any other exam or any other test. It's not going to guarantee any job. UK culture and America practice are too difficult. That's again is big myth we have come across from the doctors. UK is a multicultural society. They're very friendly, very accepting people, very lovely. I worked 20 years in NHS and I enjoyed the environment, enjoyed the team, enjoyed the people, and everybody is safe and secure. So it is a myth that UK is not accepting of friendly environment here. Another method that you can take PLAB 1 and PLAB 2 unlimited times. Not at all. PLAB 1, you have got maximum 4 attempts, February, May, August, and November. After 4 attempts, you could not pass your exam, then you need to provide your special evidence that you have improved your knowledge. Then it's entirely up to GMC to allow you the fifth attempt. Same is the case for the PLAB 2, but PLAB 2 happens every day. GMC takes every day because of so much demand of doctors, so much shortage of the doctors in the UK. GMC is taking PLAB 2 every day. And 4 attempts, if you can't pass in 4 attempts, then again you have to provide the special evidence that you have improved your knowledge and skills and you have taken some special training so that GMC could allow you the fifth attempt. Again, PLAB is only for the junior doctors. No, any doctor at any stage of their career, they can take PLAB. There's no age limit, so they can take it. Uh, you can't prepare for the PLAB while you're working full time. Not at all. While you are with us, what we do, we give you the proper plan, proper strategy, either the 60-day planner or the 90-day planner, 120 days planner. Will keep your balance, work-life balance, and exam balance, and you can prepare it. Eligibility is eligible. Yes, yeah, we have mentioned that what's required for the, to take the PLAB. After PLAB, You can't start working immediately. There are certain requirements. Passing PLAB is passing another test or another exam, but after passing PLAB, there are lots of other things. Your clinical attachment must be there so that you have got induction to NHS. Your local reference must be there. You should have some CBT courses. You should have some mock interview preparations. You should have some consultants who could review your CV to advise you properly. And you could give you the career counseling, what specialty you should apply, where is the demand, and where you could get the job easily. So passing PLAB is nothing to secure your job, but after that, there are lots of things you must do to secure your job within the 6 months. Quickly, if I summarize it, or all those things, that we need to understand the PLAB exam formats, what are the financial strengths, immigration concerns, time management and study, about the PLAB exams, preparation, how they could prepare for the language test, who is going to help them, support them, should they join themselves or should they prepare from the YouTube, and emotional psychological stress, which is a big thing. As I mentioned, somebody never moved from one city to another city, moving different country. You'll be going, family here, nobody here, no friends here. So it is a bit difficult for them. Additional support, sometimes they need it. So these were brief summary of all the potential obstacles, worries of the international medical graduates. Now we're going to tell you how we could help you. Uh, for any of the international medical graduates, especially we're here for the doctors from the India, if you have got any of those worries, we are specialized. We are going to hold your hand from the day one. The day you are thinking, I want to go to the UK, just contact us. We have got our office in India. We'll share our contact numbers. Give us a phone call or drop us a text. We'll hold your hand from there. That's it. And we'll stay with you like your shadow till you get your job. We will do everything for you. This is the beauty of Hive Medical Academy and all of us, that we put you at heart of everything. We take away all your worries. We take away all your obstacles. We will resolve all your hurdles. We'll do everything. You just focus on your studies, and we will help you to pass your exam step by step. And this is what our mission is: to support, guide, facilitate, and empower you in the NHS. And it is very easy. I have done it. Being an international medical graduate, I have done that journey. And you are in far better position. You have got so many people to stand with you, to reassure you at each step of your journey that yes, don't worry, we are here for you. We're holding your hand. So we'll never let you fall, and you'll be successful in this journey. What else we do? We have the comprehensive, as Dr. Alicia mentioned, you have the people who are expert, they have got decades of experience, either it's the English test, or it's the PLAB, or it's anything else, or immigration. You have got the people who have been in the in the experience of more than 40 years. So they are going to provide you everything at your doorstep, very comprehensive exam preparation. They will support your mental well-being. They will make you transition from your country, from your healthcare system to the UK very smooth and pleasant, that you will enjoy it. You will get 24-hour support from the doctors, from all our team. They're available. I always say that we are just text away. Even if you're thinking you're in final year, you're thinking that you want to do the PLAB, just drop us a text message. You will get the full support, and will give you proper plan, strategy, and everything. Each step will stand with you. There are some success stories of our doctors who have successfully completed this PLAB journey from their country. They transited this journey, and very successfully they're working in the UK now. These are about PLAB. So yeah, as I said, the ultimate goal is you just focus on your studies. We'll do the rest everything. You don't need to worry who is going to pick me up from the airport. You don't need to worry about where you're going to live. You don't need to worry about how you're going to do the clinical attachment. You don't need to worry where you'll get the CBT courses. You don't need to worry how you're going to do the mock interview preparation. We will do everything. We'll help you to pass your English test. We'll help you to pass your PLAB 1, PLAB 2. We'll book your accommodation. We'll pick you up from the airport. We'll give you the local SIM, and we will make you comfortable in the NHS, settling down and start your beautiful career. Global Medics NHS program, this is specially designed for the international medical graduates. That's your worry-free plan. If you want to have any medical students who are fourth year, final year, or any doctor who are at any stage of their career, if they're thinking of coming to the UK, this is for you, where you will spend very less money, you will be stress-free, and you will have the experts at your doorstep to provide you everything. And these people will hold your hand till you get the job. And even after that, you will get the lifetime membership. The beauty of this program, if you, unfortunately, if you fail your exam at any state, like English, PLAB 1, PLAB 2, you don't have to pay extra. At the same one of cost, you will pass your exam. You're lifetime member of the Hive Medical Academy and all our companies, and you will get the benefit after that. If you need more support, like you want to bring your family, you want to buy a new house, you want to buy a new car, you want to anything you want to do it, we will be there for you. So it's the lifetime membership, you'll get it, and you'll be very free. These are our contact numbers. Feel free to drop us a text message or drop us an email. We are always there to support and guide and make your journey very pleasant and smooth. I think I tried to finish within the time. I had too many slides. So, but we're more than happy to answer any of your questions. Please either drop in the chat box or drop us email. I will pass over to Dr. Umar, who is our academic lead. Dr. Umar is graduate from the Liverpool University, local graduate, born and bred in UK, and he has got the more than 20 years of experience. He's been a tutor. He's been a tutor in Manchester University. He's been a trainer for junior doctors, pharmacists, ANPs, NPs, and so many. So over to you, Dr. Umar. Now,
Thank you, Dr. Skill. Thank you. Good morning, everyone. Wonderful to connect with you this bright and sunny morning here in Manchester today. Okay, let me just share my screen. So a brilliant presentation from Dr. Shakil on the worries, the things that people are concerned about, the whole journey, what Hive can do and what BPME and InSync, our partners, can do. And so my job now is to tell you guys a little bit more about the academic side, give you an overview of the exams, what they're about, what they're looking for, a few tips on how to prepare, and the importance of guidance and mentorship. Okay. I'm not going to spend too long on this, but just as Dr. Skills just mentioned, I was a UK graduate. So I was born and bred in the UK, did all my education and training here. So I understand the system inside out. I had a wonderful 15-year clinical career in the NHS, 5 years of which was training. I did the foundation program, so I've been through that as well, F1, F2, then did GP training, and then spent 10 years as a senior GP. And during that time as well, I got interested in teaching and training. So I've done that for a decade now, and this has included university lectureships. It's included examining, particularly OSCE examining, which is, of course, what PLAB 2 is. I've supervised foundation year 2 doctors. I've supervised GP trainees. I just love the ability, the chance to pass on the knowledge and the experience that we've gained over our careers, and it really is my passion, and that's what I bring to Hive and to our programs. I've also had some quite a lot of experience in clinical leadership positions, so lots of experience in managing and directing services and colleagues, etc. So lots and lots of experience to bring to the table, which hopefully you guys will experience when you enter our programs. So that's enough about me. Let's talk about the exams, which is what everyone's here to actually learn about. So two parts to the PLAB journey specifically. Obviously, we've mentioned other parts of the journey as well. I'm not going to touch on them again. We're just going to discuss about the exams themselves, PLAB 1 and PLAB 2. So to summarize this slide, PLAB 1 essentially is it's an applied knowledge test. So this is not your ability to recall or rote memorize the 150 causes of clubbing or something similar, all the possible causes of a heart murmur, etc. This is your ability to apply your knowledge to clinical scenarios, and that's what PLAB 1 is about. So there, it will cover common conditions. So these are things that are seen very often in the UK. It will cover important conditions, acute conditions, emergency conditions, and the long-term management of conditions which are managed in primary care specifically. That's PLAB 1. PLAB 2 is an OSCE examination. So it's an objective structured clinical examination. We'll explain a little bit about what that means in a few slides' time. Of course, this is a practical exam. So it tests not only your knowledge, but more it focuses on your communication, your ability to connect with the patient, to take a history, to do an examination, to add all that up, to put all that together, and then come up with a management plan or an explanation or some way forward to move the clinical case forward. And of course, both these examinations are focused on the UK guidelines and the UK priorities for these conditions. So this is going to be a big shift and a big switch for you guys coming from your home country. And this is why experienced mentorship and guidance is extremely important. So the PLAB 1 exam, which you can actually sit in India or in most other countries as well. It's a multiple choice. Actually, it's a single best answer examination, which is slightly different to multiple choice, but it's a MCQ type examination, 180 questions, 3 hours. So 1 minute per question. It's quite time pressured. There's a short scenario which usually gives an example, gives an explanation of a clinical presentation or a particular set of symptoms, and then it's followed by a question, and then you have to select the single best answer out of a possible 5. PLAB 2, it's 18 scenarios, each lasting 8 minutes in total. Total time of the examination is 3 hours and 10 minutes, so it's quite long. And you have 90 seconds before or between each station to read the instructions and understand what information you need to know and have a think about how you're going to approach the station. So it is 18 stations, but there's usually 2 rest stations where you will not be doing anything. So it's actually 16 clinical scenarios or a mixture of scenarios, examinations, history taking, procedures, etc. Okay, so that's a quick overview on the examinations, what they consist of, the basics. Let's now have a quick chat about PLAB 1 and a little exploration of some study and examination strategies. So we at Hive, we're really big on being organized. We're really big on planning and ensuring that we give you everything that you need to succeed. So we speak a lot about this, the plan, study, practice, analyze cycle. What that actually means is, of course, the PLAB 1 is a huge syllabus. You have to actually cover a huge number of conditions, possible presentations, investigations, drugs, etc. So there's a lot of information that you have to get through. And you can't really get through it sufficiently unless you actually plan what you're going to do. So that's part 1. Then, of course, there's the study. You are going to have to put in the work. It is going to be a lot of work. For those of you who are fresh graduates, this will come much quicker to you because you will have covered lots of these topics and these areas and these subjects very, very recently. For people who are a bit further along in their careers, it's going to be lots of revision, hopefully, and there's going to be some new stuff as well, because you might never have done obstetrics and gynecology, or you might never have done pediatrics or some other thing which you will need to learn about and you will need to study for this exam. So you will need to put in the work. Then comes the practice. It's the PLAB one is an MCQ exam, 1 minute per question, 180 questions, 180 minutes. So you have to have lots and lots of practice. Our question bank has around 5,000 MCQs, and we have 10 mock tests. 10 mock tests means you can actually simulate the exam scenario. It's timed 180 minutes, and you can sit there and do these mock tests 10 times. All of them are different. So you have an enormous chance and opportunity to practice and put your knowledge to the test. Now, the last part, which is what most people miss out or they forget, is to actually analyze how you are doing. So when you hopefully join us and when you come on board, we'll go through what we mean by this. But essentially, what we are doing is you're planning, you're studying, you're practicing, and then you're analyzing and you're looking at the areas where you are weak, where your knowledge is still a little bit low or is not quite up to scratch, and then you're going back and readjusting your plan and then studying them areas. So that's the cycle that we will take you through. Now, there's a few other things which I think are important to mention. Learning styles, knowledge, and exam technique. So learning styles is something, unfortunately, I don't hear or see a lot of people talking about this these days. This is something that I really got interested in whilst I was studying myself. So everyone is a different type of learner. So some people are visual, some people actually learn better with audio, other people need to make notes, etc., etc. So there's different learning styles, and it's really important to understand what your best learning style is. That's because you will then become more efficient and you will use your time better and you will retain the information in a better way. And our resources, our curriculum covers all the learning styles that you will need. We have video lectures, we have audio lectures, we have flashcards, which are essentially revision notes, which are already prepared for you. And then, of course, we have the questions as well, because some people don't actually, they miraculously somehow don't do a lot of study and they just learn from the questions themselves, which I wouldn't recommend personally, but a few people can do that. The knowledge itself about the exam. So as I've already alluded to, it's not just the amount of knowledge that you have, it's your ability to apply that knowledge. But of course, the knowledge needs to be correct. So, you guys, whether you're fresh graduates or whether you are quite advanced in your careers, you will have lots of knowledge already. You may have lots of clinical experience, or you may have little clinical experience, but the knowledge is already there. However, to succeed in the PLAB exams, that knowledge needs to be modified and it needs to be adjusted because, of course, you're coming to the UK system. You'll need to understand and know about the drugs in the UK. You'll need to understand and know about the guidelines. You'll need to understand and know about even the non-clinical aspects of practice in the UK, whether that's the ethics of certain scenarios, the legal aspects, etc. And so there's lots and lots of new things that you'll need to add to the knowledge that you already have. And of course, all of these are covered, all the areas are covered in our resources. Exam technique is extremely important. You can have all the knowledge in the world, but if you don't know how to answer 180 questions in 180 minutes, if you don't know how to first of all, read the question properly. It sounds really basic, but the number of people who actually make this mistake. What is the question actually asking? So, taking note of keywords, missing a word, missing a negative word in the question, which actually flips what it's asking you, and thinking the question is asking something else. Understanding what the question is asking. You have to first read the question. You've got to read it properly, but quickly. You've got to know what it's asking you. Then you've got to draw on, you've got to ignore the irrelevant information. There'll be things in there which are extremely important and pertinent to ensuring you get the correct answer, but there'll be things in there that are irrelevant. They're not put in there to distract you. They're just space fillers. They're just giving you information about the clinical scenario, but they make no difference. You have to ignore them and you have to focus on the important things. And then you have to draw on your knowledge. You have to draw on your memory. You have to apply that to this question, and then you have to select the answer, and you have to do all that in a minute. So exam technique, being really good at that and being slick at that is extremely important. And you cannot do that without lots and lots of questions. And in particular, you cannot do that without putting yourself in that exam scenario several times, at least 10 times if you do our course. That's how you should do it. And to ensure that you can actually answer them questions properly, and you can do that with enough time to ensure that you tackle everything. So it's you guys are good at taking exams, you're good at studying, you're good at learning, and you are good at explaining yourself, and you're good at answering questions. That's why you're a medic already, and you've already done it. That you need to adjust that now, and you need to refocus it towards the PLAB curriculum, and that's what we're here to help you with. So let's move on to PLAB 2 and have a look at PLAB 2 and what kind of things are tested in PLAB 2. So there are three main domains of a PLAB 2 scenario. There's the data gathering, technical and assessment skills, there are clinical management skills, and then there are interpersonal skills. So what are these? So data gathering is everything you do in a scenario, in a clinical situation, in which you collect the information. So this could be history taking, this can be physical examination. This also covers practical procedures and investigations as well. Then you have clinical management skills. So what is clinical management? This is being able to, what we in academic circles talk about clinical reasoning. It's actually using the information that you've obtained to then formulate a diagnosis, explain something to the patient, or formulate a management plan and negotiate that with the patient. But the third thing, which is one of the most important in PLAB 2, is the interpersonal skills. So this is how you speak to the patient, how you establish a rapport with them. How do you use open questions, closed questions? How do you keep the patient involved? How do you stay patient-centered? How do you demonstrate professionalism and understanding of ethical principles, such as consent and confidentiality and everything during this 8-minute scenario? So as you can see, there's lots of skills involved in the demonstration of your capabilities in PLAB 2, and these cover clinical skills, practical skills, and interpersonal skills. So what actually happens in the PLAB 2 stations? You will either be faced with a simulated patient or an actor. There may be a model in there, there may be mannequins, or there may be high fidelity mannequins like SimMan or something else which has the capability to actually interact with you and show some clinical signs, and for them to assess you without actually having a real patient there with the clinical signs. There's common practical procedures, so phlebotomy, cannulation, catheterization, etc., the whole list of things that could come up. Or there could be, and there is an interaction between you and another person, which can be face-to-face. So that would be a simulated patient. It can be via the telephone, or it can even be in writing. So you might be asked to do a prescription. So it might be a prescription station. So these are the kind of range of scenarios that might face you in the PLAB 2. So we mentioned the three main domains, but what is the actual weighting of the marking of the PLAB2 mark scheme when it comes to these three domains. So as you can see, the communication and interpersonal skills is 50 to 60% of the weighting. And that's because obviously, of course, in PLAB1, your your knowledge has been tested to some extent. And so the main focus is now on your ability to communicate, interact with people, take a history, and build a rapport, etc., negotiate a plan, and all of these kind of things. Clinical skills and examination is 30 to 40%, and the ability for you to apply your knowledge that you already have to a particular scenario is 10 to 20%. So it's the interpersonal skills are extremely important. And of course, coming from India or coming from any other country, excuse me, you may have been trained in a different way. You may have picked up certain skills or certain habits in the way you communicate with people. You may have a totally different outlook when it comes to medicine and how patient-centered you are, and even on things like consent and confidentiality. So the shift that you will need to make and to orientate yourself towards what the examiners are looking for, what the GMC is looking for, and not just what the examiners are looking for, but how you will need to practice in the UK is potentially massive. And so this is why you will need lots of guidance and lots of practice. So what do you actually need to do in the PLAB2 stations? Number one, you have to actually appear. Now, I did OSCEs. I examined OSCEs for years and years. And as soon as somebody comes in, as soon as they start speaking and communicating and start tackling the scenario, you can tell, I can tell within 30 seconds how many times somebody has done this before, how many times have they spoken about this issue with the patient, how many times have they done this examination, how many times have they taken this history. You have to appear slick. You have to be slick. You have to look like you've done this 1,000 times before, because you should have done. Because that's the only way that you can actually get good at these things. You have to practice and practice and practice. So you have to appear confident. You have to be empathetic towards the patient, and you have to be decisive as well. You have to be all of these three things all at once without appearing arrogant or without appearing distant or without appearing paternal in the way you are having a conversation with the patient. You have to be patient-centered. This is extremely important in clinical practice in the UK. The patient is at the center of everything. And you have to be safe, of course. You can't do things that are dangerous. You can't miss potentially serious diagnoses. And you have to pick up red flags, etc. So this is difficult. PLAB2 is difficult. PLAB1, you're a bit in you're more in your comfort zone. Your MCQs is just you and the paper, you and your knowledge, you and the questions, and no pressure apart from just the time pressure. In PLAB2, you have an audience, you have the patient, you have the examiner, and you have to actually show that you can do all of these things safely, confidently, and sensitively. So this is difficult. It takes lots of coaching and it takes lots and lots of practice. And that is what we do in our Global Medics NHS program. For PLAB1, of course, we've mentioned there's lots and lots of resources that are online. We also have live classes to guide you through that. But for PLAB2, there's an online part of the course where you can watch videos, watch lectures, listen to audios, work through cases yourself, study our notes on how to approach different types of cases and different areas. And then, of course, you need to do the face-to-face part, which is most important, where you will actually be with us in the academy and getting live feedback, live assessment from myself, Dr. Shakil, and the rest of our team, who have got years and years of experience in examining and teaching and training. So I've already touched on some of these. Practice, you cannot practice enough, but it has to be guided practice. You can't practice on your own, or somebody, you know, who knows nothing about the PLAB exam, has never worked in the UK, never spoken to, you know, a native English speaker. You know, nuances of communication are really important, and they really stand out in PLAB 2 scenarios. If this is something that you are unaware of. So the practice has to be guided. The 90 seconds that you have, excuse me, before each scenario, you have to use them really well. You have to not only make a mental note of the important pieces of information, which will be there in the station as well, so you can look at them again. Don't have to memorize them, but you have to take note of the important piece of information. You have to think about how you're going to approach the scenario. You have to kind of remind yourself of the things not to forget, etc. So you have to use them 90 seconds well. Have a structure or a framework to how you take a history or how you do an examination, not a script, because like I said, having done OSCEs for years and years, you can spot the scripts from a mile off. They look robotic, they don't look natural, very off-putting. But having a structure or a framework is important because it's normal, it's common for you to go blank in certain times in examinations. When you have a structure or a framework, then you have something to fall back on to get yourself started again. Mnemonics and prompts are fantastic. There's so many of these, and obviously there's going to be loads that we will go through and tell you about and teach you about in the PLAB 2 Academy, ICE and Spikes and SMART and all of these kind of things, which are really, really good for reminding you about important things in particular scenarios. The final thing is that there are 2 golden minutes in a PLAB 2 scenario. The first minute, which is where you should just be quiet, you make your introduction, you do the pleasantries, and then you ask an open question, and then you just zip it and you just listen. Because if you listen and you listen well, then the patient will give you lots of the information within that first minute. The second most important minute is when you are doing the second part of the consultation, which is where you've done all the history taking and the examination, and now you're coming to discuss what the plan is or the explanation or the management, etc. That minute also is extremely important because you've got to set up that last 3 to 4 minutes really well. You've got to demonstrate that you have actually heard all of the stuff that they've said. You've picked out the important issues to the patient, as well as marrying that with the clinical issues that are important for you. So you've got to present them both, give them back to the patient, and then continue with the final part of the consultation. So the 2 golden minutes are really key and really important. If you do them well, you're well on the way to success. So this slide is not to scare you, it's to motivate you, and it's to demonstrate that if you don't prepare properly, then the PLAB can be a very difficult exam to pass. So these are the percentage of candidates taking the examination who passed over the last 5 years. So the overall percentage of people. So PLAB 1, you can see the amount of candidates who passed. Let's look at it the other way. The amount of candidates who failed ranged from between 33, 34% to 20, 26, 28%. So around about a third of people will fail PLAB 1. That's a big number. PLAB 2 as well, you can see there's less. There's actually none of the years in the last 5 years have had 70% or more of the candidates passing. So the PLAB 2 is obviously from these statistics, the more difficult examination. And that makes sense because, you know, there's a whole change that people have to go through, and you have to change the way you speak and practice and listen and all of these kind of things. So again, well over 30% in most instances, sometimes close to 40% in 2023, didn't pass the PLAB 2 exam. So obviously, this is data from the GMC. There will be lots and lots of reasons for this. There will be lots of individual reasons, but there will be general themes. And in our estimation, we believe that a lack of guided mentorship, a lack of experience in terms of the people who are teaching you or who are mentoring you, or maybe not even signing up to any course could contribute to all of these things. So the importance of being with people who have gone through the journey. Dr. Shakil has gone through the journey, being with people who have been on the examiner side. I've been an examiner for several years. Having on your side people who understand both sides of the journey and who bring that into their course and their programs. And of course, as Dr. Shakil already mentioned, you are at the center of everything that we do at the Academy. So we have our structured programs, but we can also flex them to anything that you need. And that's one of our great strengths. So I would take this slide as a motivational thing, and to demonstrate and to show it as something that we feel at Hive and with our partners that we can actually improve. We want more people to pass these exams. We want more IMGs. We need more IMGs and more doctors from India, because the NHS, the demands of the NHS are huge. Despite what you see on the news or hear from people who haven't actually been guided correctly or had the proper support, there isn't saturation with jobs. There isn't difficulties in actually obtaining jobs. If you do things correctly, if you pass your exams, and then most importantly, you do the steps after the exams, then you have a greater chance of success. So again, I think I've probably gone over my time, well over my time. So sorry about that, but thank you for listening. We're here for questions. I'm going to hand back over to Dr. Alicia. Thank you.
All right. So thank you very much, Dr. Shakil and Dr. Umar. Yes, it was a lot of information they gave us, they gave you to unpack. But one, you see the incredible amount of experience and skill and insider knowledge that they have. And two, what we also note is that they bring out the things that you really need to be aware of and prepare for. I'm not going to repeat anything that was said, but just to summarize very quickly, the highlights that if you take nothing away up to this point, it's this. One, learn about the UK NHS and how it works. Our team, you can see in Hive, they are in the system, they know. Be open to possibilities. Right now, you might be thinking, oh, you know, it's a dream, it's not attainable. If you know, knowledge is power. Tackle your worries and fears. Don't assume. And that goes with the next point, to avoid myths. Okay? Lots of people, they go online. Online is fantastic. It's wonderful. However, a lot of the time you go on there and there are a lot of myths that are circulating. They're absolutely untrue. Don't fall for them. Okay. Ask questions of the right experts. And you see here, there's a panel of experts. Understand your learning style as well as your learning needs. That is very important because, as you can see, everyone is different. The next one, Interpersonal skills are vital, and this is going to tie in now with the next person I'm going to hand over to, talking about the language part and the fact that that Hive has a massive bank of PLAB and UKLA compliant materials and tests for you to practice, practice, and practice some more. So now let's look at the language requirement, because remember, interpersonal and communication skills are vital. So why is a high standard of professional English important? Well, first of all, it's a GMC requirement. They're inflexible on it. Everyone is overwhelmed by PLAB, but you have to pass your language requirement to go anywhere with GMC registration. And it is important, as you heard from Dr. Umar, in real life. Clear doctor-patient communications are needed for best care outcomes. You need an understanding of regional accents, cultural norms if you're going to a culturally different country, which the UK will be for the vast majority of Indian doctors applying to this program. You need to be able to have the language skills to handle complex and sensitive situations, as well as relatives who tend to be sometimes very concerned, very emotional, very reactive. And it's a fact, you need proper language for a very practical reason: medical, legal, insurance purposes. Because if miscommunication is because of a language or communication issue, it is going to be a huge problem for the institution you work for, as well as for you as a doctor trying to get another job. Okay? A common error that we have come across is that doctors, as Dr. Umar said, you guys are the most tested people in the world, you do test well, but often doctors come to us and they've underestimated the language test. Okay, it's like, yeah, I'll go and do my OET next week. They go do their OET or their IELTS and they don't succeed. But you need to understand that language is a completely different style of learning, completely different concepts from basic medical science or clinical medical sciences. So you're not learning facts and facts and facts. It's kind of like PLAB 2. You're applying knowledge, but that knowledge comes from literally conditioned reflexes of your brain, stimulus and response. You need a different approach. And for that approach, to understand how to shift your thinking, you do need expert tutoring. And the next person who's coming to speak is a master at that. You also need to be very, very self-aware, what we call metacognitive learning. You've got to ask yourself the right questions. What are my weak areas? And be honest about it. Oh, yeah, my English is good. It's not going to cut it. It's not. Okay? Test yourself. How do I perform in as for real test drills? And when you get those answers, don't challenge the test. Look at how you can change your approach, your thinking, your knowledge, your performance to do better the next time. And be realistic. Now, some people coming into this GNMP program, what they have done is they have done IELTS or OET at the same time they're doing PLAB 1. And that is fine for many, many, many people. But again, be honest with yourself. Should I do my language test, get that out of the way, and we'll talk about that, and then focus on PLAB, or vice versa? Because the goal is to succeed in your OET or IELTS in your first try, or at the very least your second. You want to save time. You want to be cost effective. We cannot tell you, Shane and I, how many times students just do the test over and over and over and over again. And what they're just doing is repeating the same errors. They're not learning anything from their past performance. Okay? So this is why you need an expert tutor who will really get in there, tell you like it is, pull you up by your bootstraps, and make you perform well. Again, should you be realistic, focus on one test. However, it is probably because your OET and IELTS results are valid for 2 years to just get it out of the way. Okay? Work with us on the language side, get your OET, your IELTS locked down, then you can relax and you put yourself in the hands of Dr. Umar and Dr. Shakil. And an interesting point, especially with the language-based tests, is that these tests are available both as the written paper-based test and the CBT. And it is always a good idea to practice at least sometimes in the format in which you will be sitting the tests. And the great thing about our partnership is that with our platforms, those doing CBT have plenty CBT practice, and those doing paper-based tests also have the same. So we believe in, oops, I am so sorry about that. My hands are a little faster than my eyes. Right. So we believe in flexible learning modes. So for example, at Banfields, we specialize in online self-access learning because there are those who, because of location, work, or family commitments, they don't have time to join a scheduled class. And there are some people who are just introverts, loners, whatever you care to call it, but they have a personal style that they prefer self-guided, self-paced, or one-to-one learning, however, with support. And all of our courses, even our online courses, you have private tutoring and asynchronous study support available to you at your fingertips at all times. So for us, for example, our online learning management system, it's easy to navigate. You don't have to go into this massive course and go, where do I start? The steps are clear. They're right there in your face. Just follow the arrows literally from one step to another. Once you put in your answers, the answers are automatically scored. And again, if anything comes up, you don't understand the explanation that's given for the answer, you just type right there, post a comment, and it goes straight to BPME study support, and someone provides you with a comprehensive answer. And I'll admit, most of the time it's me that does that. And for your private classes, it is a simple Zoom interface. And now in this age, most people know Zoom, but don't worry, even if you don't, you literally click and join the class. That's it. Okay. So what I just described to you is the course that will be in the GMNP program. It is called the Premium OET Online course. Remember, this is a self-study, self-paced course. It is a 67 comprehensive online course. And please remember that we are OET Premium Preparation Partners endorsed by Cambridge OET. So what we present to you has gone through the paces in our training. So just little snippets there that show you the guided video tutorials and that we use standardized materials for our course. Our video tutorials are guided. There are many, many practice tests. You've got your private tutoring. You don't have to figure out how to book it. Once again, you just book it in the course, follow the arrows. We do full mock tests, both paper-based as well as computer-based, as for the real tests. So you can test yourself, see how you perform. And we have these tips and strategies, ebooks, which are great for review. For those of you who go, oh, I don't know anything, the day before your test, you do. You're just panicking. But we've got this wonderful series called the OET ebook, the OET Coach ebook series for those doing OET, which is a tips and strategies book. So very briefly, that's me with the online. However, if you're in Chennai or can be in Chennai and you want the physical classroom, which the Indian market is very much a physical touch to teacher classroom, we have our in-class structured courses with the language trainer master, Shane Jordan of InSync in Chennai. And now I will hand over to Shane, who will give you his side of things. Hello, Shane. Welcome.
Thanks a lot, Alicia. And thank you so much, Hive, for having me on board. It's my pleasure. All those of you who are on this program, so I'm Shane Jordan, and I'm the director of InSync Learning and Development, and we specialize in test preparation for most of the international proficiency tests. And I've been in the industry training specifically for English language and other skills for almost 24 years now, and most of my years have been with the British Council, and I'm grateful to them to give me such a beautiful, wonderful exposure. And I've worn many caps, for the British Council. So I've been an IELTS examiner, I've been a teacher trainer, a business English, and a corporate trainer as well. But my specialism was always assessments. And I specialize with assessments. And that's why today I'd like to talk to you about the difference between knowledge and skills. So that's what we look at, building skills. And as Dr. Umar and Dr. Shakil also specified, that skills are very important for PLAB 2 as well, the interpersonal skills. So the first step, I was noticing earlier that the first step is, apart from you being a doctor or your qualification, is your English language test. So without that, you're going to face problems. And most of the English language tests from Cambridge, like the IELTS or the OET, they're testing you on basically your skills, not your knowledge. So no amount of knowledge can help you pass a proficiency test like the IELTS or the OET. The knowledge is 30%, 70% is you have to demonstrate skills. So when you talk about skills, it's all about fluency in all 4 areas: listening, reading, writing, and speaking. So that's where we come in, and that's where we specialize because of the past experience and certification. So we know exactly how to build skills. So our training is 100% student-centered, task-based training. So most of the time, doctors, nurses, they keep asking, which is the best test to take, whether it's IELTS or the OET, because there's a lot of rumors, myths in the market. So let's look at some of the pros and the cons, and I'll share my personal view why doctors should go with a particular test. So both these tests are international proficiency tests. Both assess all 4 skills. And if you look at the IELTS, definitely the price factor is there for the exam. Yeah. And if you look at the range of materials, IELTS has been in the market for almost 35, 40 years. So there are plenty of materials, resource materials to practice. However, no amount of practice tests can help you pass an exam. As Alicia widely said, you keep practicing without doing reflection or without doing test analysis, then it's going to be difficult. And of course, the topics are unpredictable, nothing related to health. Maybe once in a way, you might get something like a cesarean baby or a deep sleep deprivation, probably one passage, but not sure that it could be all health related. And recently, we've noticed that for the IELTS, the pass rates have dropped. Okay, the reason being, as Alicia said earlier, candidates want overnight to pass the test. They feel like we have a magic wand and then they can get through the test in 3 to 4 weeks. And then they burn their fingers. We have candidates 14, 15 times they've burned their fingers and then they've come to us. So they've got a lot of knowledge. Unfortunately, the skills are not there. And specifically for the IELTS, we've noticed that to get a band 7 in writing is absolutely, you have to work out of your skin, because the parameters for Cambridge are pitched very, very high for a band 7 in writing. That means you're an advanced user. But if you look at OET, that's what I favor for my doctors, because in PLAB 2, and even for your OSCE, with the practical part, you need to demonstrate. So if I were a doctor, I would definitely go for the OET. Yeah, so it prepares you for your careers abroad. So for example, in the speaking, in the OET, you have how to initiate, how to build rapport, yeah, how to explore patients' ideas, their concerns, how to screen a patient, how to make it patient-centered. So all these things are already there. So the only drawback that I find, the con, is the fees are very high. Okay, but unfortunately, that's OET, and yeah, so, but the pass rates are good pass rates. So if you prepare well and you give it time, like what Dr. Shakil said earlier, it's all about planning. So if you plan well, you give it time, you respect the test, you'll get through. You disrespect the test, it's a Goliath, it's a devil in disguise. Yeah, so you got to be careful with it. So for the OET, usually doctors require, I think, a 350 in all four. And in India, most of the doctors have far better English language skills. However, like what Alicia said, that some of them, maybe with overconfidence, they underestimate the test and they feel like 2 weeks, 3 weeks course. And so what we do is to ensure, to give them an eye opener to make sure that it's reality. We do a screening test first, which is absolutely free of cost. So through the screening test, they get to know what's their level of English at the moment on the CFR levels. And then how long does it take to jump from one CFR to the next? We are very honest with them with our feedback during counseling. So there's no false promises, or we don't shoot our mouth off. So we leave it up to the candidate after that. So we tell them this is how long it might take for you, but there are no guarantees. However, we'll prepare you to the best. We support them, a lot of support, to build their skills. And same with the IELTS, it's 7.5, but we've noticed that most of our candidates get through to the OET. We have a 70% success rate in India. That's the highest. So 7 out of 10 candidates get through after our coaching. So like Alicia, we are also premium preparation providers. In fact, the second in India and only one in Tamil Nadu. And it's very difficult to get this because you really need to, show OET that your curriculum, your standards are maintained. So it's always better to get prepared from a premium preparation provider. Okay, because there are hundreds of OET preparing coaching institutes in India. But we stand apart. And I'll tell you why in the next slide. We are also from OEDP nodal partners, so we are authorized to register candidates for the IELTS and to give them those books and make sure that they have the up-to-date exam strategies. And our teachers are always trained by IDP, so they're all IDP certified teachers and OET certified teachers. And I lead most of the training, so I'm a teacher trainer as well, as I said earlier. So you have the best in terms of quality. So there are plenty of institutes and coaching centers in India, but then why come to us? The only reason would I tell you that you could come to us because we plan things for you, we are honest, and you have the best chance of cracking the test, whether it's IELTS or OET, in the first attempt. Because I don't like to see candidates back in my classroom again. I don't want to see your first attempt, get it, and move away, live your dreams. So we've got 25 years of experience behind. So I'm there, rock solid behind my teachers. Yeah, so that British Council experience with assessments really gives me an edge over other trainers in the market or other institutes. And being an IELTS examiner for 6 years, I must have trained 50,000 candidates for speaking and writing. So as Umar said, as an examiner, because that's where he doesn't need to listen to anybody. In first 30 seconds, I'll get to know where you are on a band score of 1 to 9 in the speaking, and even with OET where you are, maximum a minute or two, and that's it. We know where you are. Okay, so I have the highest qualifications as a teacher. So Cambridge, Delta, and CELTA, they are very, very prestigious, only for teachers. And not many institutes have, most of them have a B.Ed teacher teaching you, or somebody's done an IELTS TTT. So I've also got University of Glasgow. That's a master's course for teaching English for academic purpose, because both OET and IELTS, you still have to teach them academic, medical vocabulary and things like that. So how to go about preparing candidates for these tests. Yeah, so we also provide mock tests, but I am not a very big fan of mock tests. I'm a big fan of building skills, because mock tests we use only the way it's supposed to be used, to test your skills. Just doing blindly mock tests is not going to get you your scores. Yeah, so we are very cautious about that, yes. The best part with us is you never miss a class. So even if you miss, we make sure we make it up. And there's somebody always there. We're 24/7 support. We're always there to answer your questions. And overall highest exam pass rates in India. If you look at our reviews stand by it. Okay, we are even better than the British Council, a competitor in terms of reviews, and I'm happy about that. And we've maintained this for the last 9 years It's difficult to maintain 4.9 on Google for 9 years. Yeah, so our students respond well because we give them the best. It's not about, it's business. I'm more passionate about teaching, and I feel if you're passionate about something, it's very difficult to beat that person. Yeah. And we provide you the best value in terms of your investment with us, whether it's OET or the IELTS. Yeah, the best value in terms of money. Yeah. And on our courses, we 100% we can guarantee that you'll make progress because we have formative, summative examinations and screening tests. We do something called a diagnostic test, and the end of the test, we do counseling. So we make sure that you progress. And students themselves can experience the difference, that how they've moved, how they've progressed through the course in 3 to 4 weeks' time. So yeah, that's the feedback they write about us. So like Alicia, we also offer a lot of courses, but our hardcore is classroom because I'm a big fan of classroom. In India, online training can have its own set of problems with internet and depending upon where you log in. Yeah, so there could be issues. So I'm a hardcore fan of classroom training. But yes, we offer different types and they're all on the screen there. So it's face-to-face, private lessons, small group classes. Okay, we do a hybrid where you can do some modules online, some modules in class. Yeah. And we plan out things. The best part is we plan. So we sit with the candidate, we do a needs analysis, what they requires, what they don't require, their learning styles. Like what Umar said, it's so important to cater to learning styles. And we as teachers need to be technicians to find out what's the learning gap and fill that. Yeah, so we do all that. So that's a basic schedule for our IELTS OET classes. Okay, it can run from 4 weeks to 8 weeks, depending upon the screening test. We are very flexible because we understand doctors are very, very busy and they need classes at their own timing, so we offer them. We don't take more than 10 candidates in a class to make it, if we're doing a small group class, not more than 10. So that's personalized attention. And of course, there are various benefits we offer them. So by the end of the course, that's what we expect students to learn, and that's what our learning objectives are, to take them step by step through all the exam papers, make sure that they build their skills, and not only doing practice tests. Yeah, there are certain skills that candidates need to develop, especially in reading. Reading can be very tricky. Okay, very, very tricky. Writing, of course, in the OET can be tricky based on case notes. Yep, so we make sure we give them a nice comprehensive package. So if you want to really, any doctor, most of the doctors, if you want to stand at the best chance of, cracking your English test, I think you should get in touch with us and you'll witness the difference. Yeah. So thank you so much for giving me the opportunity and all the best and see you all soon.
All right. Thank you very much, Shane. So that is it for our main presentation. So right now, just to summarize about the language with respect, that was just covered, both Shane at InSync and myself, Alicia at BPME. It is important to understand the language test, and both Shane and I are of the same mind. For doctors, we highly recommend the OET. However, it is personal choice, but the reason we recommend the OET is because it gives you that extra edge. You actually get an overlap of skills between doing your OET and doing your PLAB Part 2 OSCEs. In addition to which, the doctors here, we can tell you that in real life, when you're on the ground in that hospital or in that clinic, face to face with clinics, those who have done the OET will very often send up a quiet prayer of thanks that they did OET. It's a little bit more expensive. However, it is worth it. The second point that came out for all of us, that came up from all of us, is don't be overconfident when it comes to your language. Don't assume that just because you visited the UK a couple times, or you can order coffee, or you can even watch YouTube videos and understand most of what is going on, that you'll be quote unquote fine for your tests. The academic level, the absolute high level of English that is needed both in IELTS and in OET is higher than probably you will use every day in your life, unless you are a teacher in English where you're coming from. So it's always a good idea to get an entry assessment. Okay, that is worth its weight in gold, because it tells you exactly in real terms, no covers on your eyes, no stroking your ego. It really tells you where you are, but that's good because it tells you what you have to do to get to that finish point. Avoid myths. Just like PLAB has a lot of myths, once again, English language tests have a lot of myths. So please, 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 please come to us. Ask us the right questions. We are the experts. We're not going to lie to you. We're not going to tell you something just to get your money. We're going to tell you the truth. We've been doing this for decades. We will be completely truthful with you. Understand yourself, your learning styles and your learning needs, and apply those when you're doing your English tests. Again, do not underestimate these English tests. Between Shane and BPME, InSync and BPME, we have a massive bank of materials and tests, CBT as well as paper-based. So you can get all of the experience with test day preparation that you need. And we are very goal orientated. When you come to us, we know where you are, where you want to be, and that this is one part of your Global Medics NHS program strategy. So we are motivated to get you over this, to get you in the hands of Dr. Umar, to get you in the hands of Dr. Shakil, and get you to your goal of your job in the UK. So I like to say, you aspire, you hope, you wish, you dream. We empower you to attain that dream. Okay? So start on your path to your career in the NHS today with our Global Medics program for the NHS. Ask us your questions, email us, text us, and book an appointment to find out more. Okay? This, once again, is all of our contact information, and we are here for you to ask any of your questions. So on that note, I have wrapped up. Yes, we have gone a bit over time, but this will be available on YouTube for people to watch and rewatch as much as they want. So going back to the main panel here, are there any things you want to add? Anyone? I'm all talked out, so you guys are.
Yeah, Dr. Umar, anything you want to add?
No, I think we've all covered everything.
Okay.
So thank you.
So on that note, thank you everyone. And once again, remember, reach out to us, contact us. We will also attach all the contact information for reaching all of our parties in the material, in the information attached to this post. And we look forward from hearing you. Join us.
Thank you
Bye-bye.
so much.
Bye,
Thank you.
everyone. Bye,
Bye-bye.
everyone. Take